Okay, so today we're going to do chapter 15, which is behaviors. So this includes um, our CNS stimulants and non-stimulants and non-pharmacological therapies for ADHD and that's the only thing we're doing. Sorry. The only thing. And that's the only mood disorder we're working on in chapter 15. So distinguish the actions, uses, and side effects, and adverse reactions and nursing interventions, and then plan care accordingly for medications for ADHD. So that's our CNS stimulants, our non-stimulants, and our non-pharmacological therapy. Okay? All right, so ADHD, what is it? We're going to talk just a little bit. I know there's like a couple slides that really talk more in depth, but we're not going to do that. We're just talking about a little bit of it. Okay, so ADHD, I have some strong feelings of it. It is a poor attention span, control issues, hyperactivities. There's ADHD and there's ADD, which is attention deficit disorder or attention deficit hyperactivity disorder. So one can be hyperactive, one can be not. It says that boys are more likely diagnosed because boys show the hyperactivity in the outside emotions. Girls aren't usually aggressive, but may have more mood swings. In my experience, the ADHD is on the inside. The hyperactivity is in our brain, not so much our actions. So whereas boys bounce off the walls, we're bouncing off the walls inside our own mind, and it's constantly going and never stopping. But symptoms of ADHD are easily distracted, failure to receive or follow instructions properly. And it also depends on the types of instructions, whether they're verbal versus written. That can be a factor in it. And especially if it's a lot verbal, I don't want to, personally, I want it written. If it's a lot written, I might want it verbal and shortened. And but failure to actually follow instructions is one of the symptoms. Inability to focus on one task. We might be jumping around to other activities. Difficulty remembering. Frequent loss or misplacement of personal items. Excessive talking, interrupting of children. That's a big one. Inability to sit still when you've asked them repeatedly. Impulsiveness and even sleep disturbances. They may have insomnia or um, they may sleep all the time. Um, it's one or the other. Okay. Oh, no, no, no. Sorry. Okay. I pressed the wrong button. Sorry. So it's a dopamine problem. You know, a lot of people say follow the dopamine because we lack the dopamine with ADHD. So you're trying to find whatever gives you that dopamine hit and makes you feel good. And so that's why you're bouncing around from different activities and different activities because you're looking for that dopamine hit. Um, we we're talking about children here. Okay, adults obviously have ADHD too, but we're going to talk about children specifically. So there's multiple different types of treatments. There are stimulants, there are non-stimulants. Non-stimulants, we're going to talk about on the next slide, the stimulants as well. But the non-stimulants are good because they usually don't have the really bad side effects. They're not usually addictive like the stimulants are. But they do both help. Okay. So our non-stimulants, that's the atomoxetine or Strattera. Common side effects are headache, insomnia, upper abdominal pain, decreased appetite, cough. Suicidal ideations, though it is not a common side effect, it is a side effect that needs to be noted. Our patients and our family and everyone we talk to need to know about suicidal ideations as a possible side effect so they can be preemptive and know that what to look out for before it happens. Other medications that we use are clonidine. Clonidine is used for hypertension, but it can also be used for ADHD. It can also be used for ODD, which is a oppositional defiant disorder. So there is other things you can use clonidine for. Same things apply. If we're using clonidine versus hypertension and we're using clonidine versus ADHD, guess what some side effects are? Hypotension, orthostatic hypotension, dizziness, right? We know not to stop this abruptly. We have to wean them off. So those things are still important. Um, Guafenicin, um, I think I said that wrong because I always say guafenicin and it's guafacine. Sorry about that. Guafenicin is the cough medicine. Guafacine is an ADHD medicine. They're very easy to get confused, so don't do that. Um, guanfacine is used for ADHD. It can cause insomnia and hypotension. This medication can also help with appetite. If your patients are having decreased appetite from the Strattera or the stimulant medications, sometimes this one can actually help, um, which is a good thing because we don't like our children not to eat. Other ones are antidepressants like buprenorphine, which is like Wellbutrin. So they can also use tricyclic antidepressants to work that for anti-ADHD, but these are like a last resort when the other medications don't because they have such bad side effects and we don't like them. So our stimulants. So these are methylphenidate, dextromethorphan. I think there's another one in your drug cabinet. Go read it. But these are your stimulants, okay? So guess what they do? They stimulate your brain, and when you stimulate your brain, you're stimulating your whole body. So just like our CNS depressants, this is a CNS stimulant, and so we can have all the opposite, irregular heartbeat, high blood pressure, okay? Heart rate could be high. You can also have dependence because this is a controlled substance. I believe it's controlled too. So there is a potential for abuse. We have to watch out for that. And we need to tell our patients that, especially if you're giving it to adults, if they have a history of alcoholism, they are more likely to be addicted to these as well. So making sure your patient, your family member all know the risks is important. However, undiagnosed and untreated ADHD is just not good for you. So taking stimulants because you need them is okay. Things that they do are drug holidays or yeah, holidays. This is when we tell our patients, okay, you take this for they're in grade school, right? And we're out all summer. You don't need it. If you're bouncing off the walls and you're going to summer camp, go bounce off the walls at summer camp. Do you need to pay attention and do well on your test? Probably not. So a lot of times I do drug holidays. I know my cousin or my adopted brother basically, he has horrible ADHD and he doesn't take it on the weekends. My parents wish he did, but he doesn't because they are trying to limit how much he's actually taking, and that's okay. Um, Other things that we need to tell him about is misuse can lead to death or CV related death, which is cardiovascular. Um, so we have to worry about, heart attacks, things like that. Things we want to avoid, caffeine, okay, because that's also a CNS stimulant. Any other CNS stimulants. MAOIs are a big one also because of the hypertensive crisis, because it's a stimulant and the MAOIs, always affect everything. Another thing is the grapefruit juice. We don't have drink grapefruit juice with this one. Um, Contraindications, marked anxiety, agitation, psychosis, um, motor tics, Tourette's. It can increase the Tourette's. Tourette's is when you have impulsive movement, or words or tics almost. But this can increase it. If they're ER or SR, which are delayed release and are sustained release, you have to swallow them whole. Do not crush them. Do not half them. They are whole or nothing. Like we said, avoid caffeine. Things that we're looking for is all of that list of things that were symptoms, like the um, poor performance in school, inability to concentrate. We're looking for that to work. So when you have your patient that has all of these symptoms and they come back in a month or 2 months or whenever for their review, we want to make sure that those symptoms are lessening. We have to definitely tell our patients about our possible growth chart problems. Stimulants are really bad at suppressing your appetite, and so your kids don't want to eat. And we want them to meet their milestones for height and weight. So, like monitoring our height and weight is really important, making sure that we're on track on the growth curve and we're not falling off of it. So we're making sure that they're actually eating. When they're not eating, we have a problem, okay? When they're sleeping too much or not enough, we have a problem, especially with our stimulants. Like I know it doesn't say this up here, but insomnia would obviously be a side effect because it's a stimulant. So maybe we need to get off the DR, delayed release, and go to our plain immediate release one because it's so delayed that I'm not sleeping anymore. Um, Things that we have to worry about is irritability. Sometimes, if you're not sleeping, if you're insomnia and you're on stimulants, you can be irritable. You can have poor performance if you're not performing as well in school, if your behavior's worse, if you're not focusing like you're supposed to, if your impulsivity is not reduced. Those things are important to monitor and they should be better. And if they're not, we may need to evaluate it. And if we're having one of the bad side effects, which like the dysrhythmia, insomnia, appetite abuse, not abuse, appetite suppressant. Also, when we're telling our patients about the drug holidays, we should also tell them when to take it. If it's an immediate release, we need to take it right before you go to school, okay? If it's when the sustained release, again, I would take it before to school so it works all day. But taking it in the morning is usually the best because we don't want a stimulant and then try to go to bed. It's not going to do anything, okay? It's not going to help anything. It will do some stuff, but it won't help. But we should give it on an empty stomach, and we know not to stop this abruptly. Um, when we're telling our parents about all of these medications, our guardians about these medications and what to look out for, we're telling them all the things we talked about. We should see an improvement in all of the areas they were not great in because of the ADHD. We should see, but we still have to monitor our appetite. We have to monitor those growth charts. We have to monitor their sleep. We have to monitor their heart rate, things like that. But that all of the stimulants fall under this, okay? But that's pretty much behaviors. All right. Good luck. Thank you.